If we could get started. If you think so. Tonight is our second community conversation on this substance abuse issue. It's a little different setup than last time, intentionally so. Last time we had about 27 panelists representing all areas of that interface with this opioid epidemic and this issue in our community. And it was a great beginning, at least from my perspective, because it represented the courts, the drug courts, the treatment centers, hospitals, emergency rooms, and so, and on and on and on. But what it did show us is that not only, and what I get to see, and I'll introduce some of my colleagues in a moment, is that we know that this epidemic and this issue is not a Fall River issue. This is far bigger than that. And so that first meeting showed us that there was a need for us to continue as a community to have some very honest dialogue, to work together, bringing all of our areas of expertise and passion and pain in many circumstances together so that we could work collectively. Because there are no silver bullets. There are no silver bullets. Again, I'm Carole Fiola, State Representative of the 6th Bristol District, where we're standing. That represents part of Fall River and Freetown. My colleagues in government that were able to join us here today is State Senator Michael Rodrigues, who represents this district as well and is an incredible teammate and colleague. The mayor of our city, Sam Sutter. We have with us City Councilor-elect Richard Cabeceiras in the back. Thank you, Richard, for being here. We have from Congressman Keating's office, who is a leader federally and has been far longer than I've been engaged in this opioid issue, and that's Michael Jackman. Where are you, Michael? Right over there. So some of my colleagues in government cannot stay throughout tonight, but that's why it's important that everyone has signed up, because I want this to be an ongoing dialogue. When you get an email, you'll see everybody's emails on it. I want you to feel that if there was somebody you wanted to ask a question of, because I know there are family members here today, and others involved in treatment and so forth that maybe haven't collaborated before. And that's really the mission for this type of meeting. We also have with us another huge partner in state government, and that is from our Attorney General's office. And Stephen. Yes. Stephen, your last name again?
Marshalek.
Stephen Marshalek?
Yes.
Stephen is from Attorney General Maura Healey's office. So before we begin, we had the intensive meeting the last time where all the stakeholders shared their perspectives. And from that, so many things happened. There were family members who were empowered to get more involved in this community's efforts to fight this problem. And I was very proud to see that happen. We've had a chance to work with drug court more and get to see up front and close what's happened. Had a chance to see our federal government come along with our district attorney and delivers almost $1 million to enhance what goes on with our drug court. There's many, 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 many pieces of this puzzle. But additionally, I also got to meet, and before we get into the crux of the program, which is about a 20-minute presentation of Rachel Davis from Southcoast Hospitals, is I came across in my follow-up what you're going to see tonight, which may sound very simple. It's a simple website. But we all know that a website has to be dynamic and it has to be meaningful, it has to be updated, it has to be easy to use. And so in all of my discussions and conversations, people would say, I don't know where there's a meeting. I don't know where there's a counselor. I don't know where there's treatment, medical treatment. I don't know where I go if it's the middle of the night and I'm a parent and I'm in distress and I don't know who I could call or talk to. And I kept hearing this, as many as you have. And came across Rachel, and through a state-funded CHOP grant that certainly the senator was involved with even before I came on board. It was a grant that was applied for by Southcoast Hospitals. And 3 years ago, Rachel, I think I'm correct, roughly, maybe 4? Was it 3 years ago?
No.
Not even. 2 years?
We started this last year.
Oh, geez, I thought it was 3 years.
No, that's
time
okay.
flies.
So
they applied for this money and began working on this database, and kind of thought that once it was put together, that would be it. But we all know it needs to be dynamic to be effective. And when I was introduced to it and sat down and played with it and learned about it, I just thought it was an important tool that I thought that our group here should know about. And it's not a Southcoast tool. I just want you to know that. It's a community tool. The grant is a tool that Southcoast and Stewart together will work with. It is a tool that STAR and Stepping Stone would work with. It's a tool for all behavioral health organizations to be a part of. So I mentioned Rachel's with Southcoast, but that's just because that's where she's housed. But this is a bold coalition tool. This is a tool for the city of Fall River. And so I just wanted to make that case, because if Karen Long, the head of nursing over at Durfee High School, for the Fall River school system, needs to know, is there, well, how can I direct a parent who comes to me? I thought that this would be the right tool. So before we get into that, I also want to say, I just got in from Boston, and the hearing is still going on. It started at 10 a.m. this morning on the governor's bill on substance use treatment, education, and prevention. I need to let you know that this problem that you've all come here to talk about is being talked about on every level in state government. Every town, every community, every rural community. We have Freetown represented today. My partner, Selectwoman Lisa Pacheco, is here, and she feels it's so important because of the numbers and what's happening in her town. The numbers are staggering here. Over 531 overdoses to date in Fall River. Almost 30 deaths as of November 11th. I don't know what's happened in the last few days. There's been a few more. Laura from Bold is telling us. So we gathered this morning, to talk about the governor. The governor's presented legislation. That's a first step. The Senate has some legislation, and I'll turn over in a minute, just to let the senator say some welcoming remarks. The House, we've already passed some things. We're going to be enhancing that bill. So the bill that was presented to us today is just a starting point for this session right now, and we're going to add to it. The first thing it does, and these are very controversial pieces according to what everyone's saying, and one is that there will be a strict 72-hour limit on the supply of opioids that a practitioner may prescribe for a patient in any first-time prescription, except in limited emergency situations and other carefully defined circumstances. 72 hours worth of opioids. First time out, that's all you're going to get. We all know that's been a huge piece of the growing problem. Second, it establishes new requirements for training of doctors and prescribers, and that's going to happen in the medical schools, and it's going to happen throughout their training periods. Very important. Very limited a bit of training. Doctors would get, if they're 6 years or so of medical school, they'd get like a session, a few-hour session on pain management. We all know that wasn't enough, and this bill recognizes that. Third, it's enhancing the effectiveness of the existing prescription monitoring program. And that is just a tool, as you've all heard about the prescription monitoring program. So when a doctor writes a prescription, he has to go in and check to see whether that person has been a frequent flyer all over the place to various doctors, and family members would shake their heads typically and say, thank God, because my loved one would go here, go there to the doctor. At the same time, it's incumbent upon our pharmacists, who are represented here today by one of our leading advocates and leading community advocates for this issue, and that is Tom Pasternak from Walsh Pharmacy. He's been a leader in this, and this prescription monitoring program is a tool that he's been using, and there's a whole 2.0 version coming out, recognizing the borders that we live on, and how we know doctor shopping in Rhode Island or New Hampshire or New York doesn't help us know what's going on if we're just reporting on Massachusetts data. And I asked the governor about that specifically today, and he says they're working on that, as well as dentists, who seem to be getting a carte blanche. You walk in the door and the prescription was sitting on the table before you even sat down in the chair and had your wisdom tooth out, right? You'd get your 60, your 90, whatever it was, whatever you needed. You'd get as many as you needed because it didn't matter. So that will happen.